In this video, I want to explain exactly what Optilite IPL is and why it works for dry eyes. Now, dry eyes is not a problem with the amount of tears that you have. It's a problem with the quality of your tears, and that changes everything. Most people think that dry eyes means that you just don't make enough tears, but that's not usually the main problem. Your eyes are surrounded by all these tiny little glands called meibomian glands, and the job of those glands is to put an oil in your tears. And that oil acts kind of like a lid on a pot. It slows down the evaporation of the tears. But if those glands get clogged or inflamed, which is actually pretty common, then they're not going to produce a high quality oil. They'll produce kind of a thick or clumpy oil, or sometimes won't really produce much oil at all. And so then the tears evaporate way too fast. In meibomian gland dysfunction, or MGD, the consistency of the oil changes. So instead of coming out kind of like olive oil, it comes out more like toothpaste. And that's when the air will start to touch your eye. And so these little nerves on the front of your eye that are normally reserved for when something is in your eye will start to just be triggered from air touching your eye. And so your eye might start to water a lot, or maybe you'll feel irritated or sandy or gritty or itchy eyes. That general inflammation and irritation is dry eye disease. Now, if we can fix these meibomian glands so that they're making a better quality oil, then we're treating the dry eyes and we're just helping the body to take care of itself. And there's a few good ways to do that. One of my favorite treatments that does this is intense pulse light. IPL delivers very high energy light at specific wavelengths for specific amounts of time in kind of these pulses. And with that, we're able to target specific tissue to create changes in the body. I love this demonstration of how IPL works. There's a red balloon inside of a white balloon, and when that light hits the red balloon, that red balloon pops, but the white balloon stays just fine. This really demonstrates how that light will go in and at certain layers make big changes, deliver a lot of energy. This really demonstrates how that energy is delivered to the skin, kind of bypassing that outer layer, but going into the tissue that we want to change. And in a way, this really lets us kind of repair these meibomian glands. Around the eyelids, we'll see these little pro-inflammatory blood vessels, which we call telangiectasia. These little blood vessels kind of wrap around the meibomian glands, and they're leaky and they cause a poor quality of oil to be secreted. If you see those little blood vessels on your skin, or if you have rosacea, those little red patches of blood vessels, there's a good chance you have them in your eyelids too, and they're having a negative effect on the quality of the oil that your eyes are making. IPL allows us to target those little telangiectasia blood vessels, and with all that energy, make them pretty much dissolve or denature. That's one of the things that made IPL famous to begin with. People were going in to get the little blood vessels taken care of to smooth the skin texture. They were getting age spots removed, and all these little benefits cosmetically were the main reason they went in, but as a side effect, people were noticing that their eyes were feeling better. So additional studies were done to figure out what was going on and why, until now we're to a point where it's FDA approved for the treatment of dry eye disease. There seem to be multiple ways that the IPL is causing you to have less issues with dryness. It kills the bacteria around the eyes. It kills the Demodex mites that can cause inflammation that live on people's eyes. It creates a skin shock reaction, which seems to have this anti-inflammatory effect. There is just a little bit of discomfort in the moment of the pulse of light. It's a lot of energy that's being delivered to your skin, and so there's a lot of heat there. Some people will compare it to the snap of a rubber band, and while it does kind of feel a little bit snappy with a little bit of pain there for just a moment, unlike a rubber band snap, it feels better pretty much right away as soon as that pulse stops. So a little bit of pain, a little bit of energy delivered, but very short-lived. It feels better pretty much right away afterwards. The treatment is really bright. You'll have some goggles over your eyes, and your eyes will be closed as well, but you'll still see a bright flash of light even with your eyes closed underneath these laser shields. So anticipate that it will be a very bright treatment. When you come in for an IPL treatment, you want to have your face completely clean, so it's best to come in the day of an IPL with no makeup on the face. If you have any facial piercings or anything in the nose or in this area, you'll want to have those removed. It's okay to have tattooed eyeliner, just let us know if you have that. Remember that anything pigmented or dark at all is going to heat up, so if you have a sunscreen or a lotion that has any pigment, you'll want to make sure that is off of your face. And for similar reasons, we want you to not have been out in the sun a lot for the last couple weeks beforehand, or used anything like an artificial tanning lotion, anything like that. We don't want pigment to be brought forward or pulled out of your skin. When you're in and ready for an IPL and you're sitting down in the chair, a cooling coupling gel will be applied to your face. It'll help to deliver the energy more uniformly on the front of your face, and it's nice and cool and comfortable to have that applied. IPL is an energy-based treatment, so it's all about delivering enough energy to the body to make changes in the tissue. But those changes do take some time. The FDA protocol for IPL was 4 treatments in order to prove that it was effective in treating dry eye disease. As I've done these treatments, I've come to feel that probably it makes more sense to gear it a little bit more to the severity of the dryness. As a general rule, it seems like for every decade of life, an extra treatment will be needed. So if someone is 60 years old and they're having some significant dry eye issues, they may find that they need 6 treatments to have a sufficient improvement to their meibomian glands to alleviate their symptoms. So all that being said, frequently when someone comes in and they have their first treatment, they don't feel any different after that because we've just started to deliver that energy. After their second treatment, some people will have some improvements, but still most probably won't. They're still on the right track. After the third treatment, more people will have improvements and so on. As we deliver more energy and we're getting good sleep and having good nutrition and providing the body with everything it needs, all those building blocks, the body will go about repairing itself and the eyes will start to do better. This treatment isn't for everyone because the light and energy is absorbed by pigment. If you have a darker skin color, then it won't work as well for you or might not be safe for us to do it. So that's something that we always check before we initiate a treatment. I've really enjoyed treating dry eyes this way. I love treatments that help the body to improve itself rather than treatments that depend on some outside chemical or source to help you to feel better. If you have any questions or concerns, contact our office. We'd be happy to chat with you and see if this treatment would be a good option for you.